Hey everybody, it is Kevin Henry, the host of the Dental Assistant Nation podcast, as well as the editor-in-chief for drbicuspid.com, and welcome back into this episode that is co-sponsored by Dental Assistant Nation and Dr. Bicuspid. We're going to have two experts on with us from Sterisil, Chanda Chatham and Christina Donahue. They're going to be talking about waterline safety, why it matters to your practice and your patients, and how you can make sure to keep everybody safe every day. We are back, and I'm thrilled to have a guest back with me, Chanda Chatham from Solmedics. Hey, how are you?
Good. How are you, Kevin?
I am great, and you're back in a different role this time than when I saw you last.
I am. I'm the new Director of Professional Education for Solmedics now.
Congratulations on that.
Thank you.
So here's the big question for you, with being that education.
Yes.
We know that there is ADA, Dental Unit Waterlines, CDC, the Association for Dental Safety.
Guidelines everywhere.
And guidelines everywhere. How do we make sure dental assistants are following the correct ones for their practice?
Absolutely. Well, CDC guidelines are very general. They are to monitor your water, which is really important. You treat the water, monitor on a routine basis. So that's a key piece of it. But routine, how often, right?
Right.
ADA also says, pretty general, you should monitor your water lines. Now, ADS, Association for Dental Safety, goes a little further, a little deeper, and says to monitor your water lines quarterly. So that's a lot better. I think that you're giving them a routine and helping them kind of get into that cadence of monitoring on a regular basis is great.
So going deeper and doing that quarterly thing is the way that dental practice should be going.
Absolutely.
Okay. Absolutely.
That's the only way to know if your water treatment and shocking and your protocols and everybody's doing the right thing is really working.
Okay. You know, there's some exciting stuff happening in Georgia right now.
Yes.
And I know it's drawing some attention, but I know that there's a lot of dental assistants and dental team members out there that are going, well, I don't practice in Georgia, so it doesn't matter. Right. So talk to me about what's going on in Georgia and why it matters to even those who aren't practicing in Georgia.
Absolutely. So in Georgia, they unfortunately have had a couple of outbreaks of Mycobacterium abscessus. One in 2022, and then again another one mid last year. And originally they had implemented a 2-hour CE requirement that included infection control and prevention with waterline management as part of that 2-hour requirement for your hygienists in Georgia. Well, we had the other outbreak, right? So now the Georgia Dental Board, which did a fantastic job, and I want to commend them, they have implemented a rule to test the water quarterly. They need to meet the 500 colony-forming units that the EPA's drinking standard is, and then they have to test quarterly. And if they fail their test, they need to remediate. Also, if they change any plumbing, have any equipment changes, they have to test within 30 days. So all of that is great. Also, the documentation piece. You need to document that you've done all of these things. But that is the new Georgia rule. It is pending governor signing at this point, but it will go into effect on April 1st.
Do you feel like that's a tipping point for maybe the other 49 states?
I can honestly tell I was there when the board voted to approve it, and I got chills because it is Washington State is the only other state that has legislation through their dental board to test quarterly. And basically they adopted the same rule. It follows the same guidelines or requirements that are in Washington. So it was great to see that they were active about doing something about their water lines and making sure it's safe for patients.
You know, whenever we hear about an outbreak or whenever we hear about something that happens with water, it's a good reminder of why we should be following the rules.
Yes.
And you and I were joking a little bit before we came on about those IFUs.
Oh, my
and
gosh.
How important those are. I mean, just talk to our audience a little bit about the IFUs and why you don't just brush past them or ask your friend on TikTok why this matters.
Right. It's really important. IFUs, I mean, we hear it everywhere. You hear it in dental school. You hear it in your training. OSHA trainings will tell you, read the IFUs. I understand some of them are really long. Some of them don't even work across the board with other products. So just take the time to really read those IFUs and understand them and train the staff on them. Okay. And then the second thing was, like I said, some of the IFUs don't talk about how that particular product works with another product.
Yeah.
So that's where like Solmedics comes in and our Sterisil product line. We have water specialists and we'll help you talk about how our products work together because they do. It's the only end-to-end solution and the products are designed to work together. So finding out how those work, because you need shock, you need treatment, and you need testing. How does that all work together?
Okay.
It's really important.
So I'm going to ask you a 101 question here, but I think it's really important. Why do dental assistants need to be following the guidelines in that practice?
They need to follow guidelines because that water needs to be safe, not only for the patient, but the staff as well. There are aerosols in the air. You're breathing those in. You want that bacteria level to meet the EPA drinking water standard, which is 500 CFU or less. And the only way to know is to test. So your dental assistants are the ones that are doing the work. The practice knows about all of these things. They know the IFUs. They know the guidelines in their states. But the dental assistant is doing all the hard labor, and it's sometimes out of sight, out of mind in the operatory. Having the dental assistant really know and be a champion for water safety, really is the way.
And be a champion for their patients as well.
Absolutely.
Yes. All right. So I asked you a 101 question a minute ago, and maybe I'm even going to go even deeper here.
Okay.
Why test? Why?
Why test?
Yeah.
It's a good question. Why test? We get this a lot. I'll ask, how often are you testing your water? And they'll say, why do I need to test it?
Oh, wow.
Testing it is giving you a good baseline of how your waterline status is doing. That biofilm is always in there. But also, if you're using treatment, which you should be, and you're shocking routinely, which you should be, testing is going to tell you how well those are working and how well your protocol is working. So kind of think of it like you brush and floss, right? There's maintenance. The better you maintain your teeth, when you go to the dentist, you're going to have that checkup. The checkup is your test. And if you pass your checkup or pass your waterline test, you don't have to do all the remediation. So you don't have to come back and get cavities filled, and it's more cost and more labor, more time. So if you maintain your water lines properly, and it's not hard to do, very simple with Sterisil. When you do that, you're going to pass more tests.
Well, we always want to pass tests.
We want to pass tests.
But there's also something about that 6-month checkup whenever we come back into the dental practice that sometimes there are things we can be doing better.
Correct.
And we expect the patient to go make those changes. And I think we in the dental practice have to make those changes as well whenever we see that we're not living up to the IFUs perfectly or whatever that might be.
Right. Absolutely. I know a lot of people are afraid to fail. We all are, right? It's okay to fail a test. It's going to happen. Biofilm is there. It's an ongoing problem. It's an evergreen problem. And so we just need to stay ahead of it. And the more you maintain, the more you keep check on it by testing, then if you do fail, you can do something about it and you'll have less failures in the future.
That's such a key point, and I want to hit on that. It's okay to have a failure. It's okay, but it's not okay for it to keep going, right? I mean,
Correct.
That's the key.
It is. And testing will tell you how your water lines are doing. And sometimes it happens. The water sources change in the world. There's drought, there's different chemicals that are coming into our water. So we don't always know and can control the water that's coming into the practice. And those water lines, they're small, they're tiny. They love the coaters, I call them, the biofilm coaters. They stick on the inside of that. And so it's really important to just test. And if you fail a test, it's okay. Just like if you failed your checkup when you come in, they fill the cavities, they take care of it, and you move on.
So Chanda, here's a question for you. As an industry, why is it important for the industry to make sure that these practices are doing the right thing? We know patient safety is important, but Is there more to it than that?
There is. I think we can do better as an industry. Only about 30% of practices are actually testing their water, and it's not probably because they just don't want to do it. They just don't know. And so the education really has to come out. And that's something I'm very passionate about and really want to drive home. We're part of the Association for Dental Safety, which is ADS, was OSAP, right? We're a super sponsor. We've been, hugely involved in a lot of their programs like boot camp and their annual conference. We do product sessions there as well. We sponsor, but we're always involved in staying active and learning and knowing what's going on in the industry. The Georgia Dental Board did a great job, right, with their new rule. The Georgia Dental Association is out there with their members, and we're actively working with them. And when I say we, it's Sterisil. We're out there. We're helping them with speakers, help them meet their 2-hour CE requirement, and we're there to help them support with products. We're free testing. We're just trying to get people to test so that they know. And once they do it and they're like, okay, this is like that change. Like, why do I have to do this? Is this going to be difficult? It's not. It's simple with Sterisil. So we're just showing them so they can adopt the rule and move on. And we know they're busy.
Well, thank you for taking the time to help keep patients safe and practices in the know. Really appreciate that.
Very good. Thank you.
Absolutely. And now it is my pleasure to introduce Christina Donahue, who's the Vice President of Marketing for Solomedics. Thanks for being on today. I appreciate it.
Thanks for having me, Kevin. It's a pleasure to be here.
And I know whenever we talk about dental assistants, that's something that's very near and dear to your heart. Tell me why.
Absolutely. Well, I certainly understand. I fell into the dental industry 23 years ago. I was working at a coffee shop, and there was an oral surgeon that came in every day to order the same latte. And he pulled me aside and said he needed an assistant, and I figured that was better than making coffee. So that led to the career that I've had in this wonderful industry.
Does what you learned as a dental assistant still guide you today whenever we're talking about waterline safety and everything else?
100%. Absolutely. I understand the dynamics of a practice, all the roles and responsibilities and pressures that they have. They have a lot to do every day within a certain period of time. So it definitely helps to bring that perspective to my role.
So I know Sterisil has a safe water solution. How does that help bring peace of mind to your practice, your patients, and those team members as well?
Sure. So the Sterisil Safe Water solution was designed with the customer in mind. Honestly, we're trying to take the work off of their shoulders. And so we've developed a system of products that work for the customer, not the other way around. And they were designed to work better together. And the result of that is an easy-to-follow protocol that helps our customers pass more tests, which is really what they want to do at the end of the day.
Absolutely. So testing is one of the key parts of this, obviously.
Absolutely. So there are three main categories. There's test, shock, and maintain. But you have to test to know where you are. So it's really kind of like periodontal disease. You have to stay on top of it. And so it's a continuous process of maintaining and treating the water in your water lines.
With that testing, how did that make you feel as a dental assistant? Did that add extra pressure for you when you were doing it?
Definitely, because there's a lot of other responsibilities, instrument reprocessing, flipping over rooms, wiping down the equipment, getting patients in and out. So yes, it's another thing to do. So having a simple to follow protocol and a system of products that work well together, that are designed to work well together, certainly helps.
So I know I spoke to Chanda earlier, and she talked about that Georgia and everything that's going on with their laws. Why is testing first? Why is that so important?
And I will say I'm so glad that there are more changes coming with regulations. Testing is so important because you need to understand where you're at, right? So you have to stay on top of the biofilm. And if you don't know the quality of the water you're working with, you don't know how to remediate. And we have a unique offering in the testing category. We have the only strip test. It's an in-office 15-minute test, so you can know exactly where you are in 15 minutes, which is incredible. Therefore, you know that you're treating your patients with good water, or you need to stop using that chair and unit and shock and treat the water. So we have that. We also have the R2A test, and those two go very well together. The R2A is becoming it's the gold standard, and these regulatory changes are requiring testing quarterly. And that's predominantly with an R2A test, so they get the documentation to stay compliant. But between our Fast Check 15, which is the 15-minute strip test, and the R2A, it's a perfect combination for the customer.
And I feel like that Fast Check 15, whenever it came out, it really was a game changer for so many dental practices. Why, in your mind, was it that?
It really is a game changer. It's identical to a COVID test. So within 15 minutes, you can do it right there, chairside, and find out whether you're going to pass or fail an R2A test or a lab test, which is incredible. There's no other technology on the market like that right now. And as we know, everyone in these practices are all pressed for time.
Right.
So, and it's at the end of the day, it's about patient safety and staff safety. So you want to know if you're using, good water or not.
So we've talked a little bit about Fast Check 15, and I understand there's a new member of the Fast family coming out soon. Tell me a little bit about that.
Yes. So we have Fast Read R2A, which essentially it's a white glove service. It's a benefit that we're providing our customers with early notification if the sample that they've provided with their R2A lab test indicates early failure. Okay. So we have the capability of notifying folks within 24 hours if they are going to fail. So it's a new service. And again, we want to make sure that we are providing the most efficient services and support to our customers. And between Fast Check 15 and Sterisil R2A with Fast Read, we feel that we are able to do that very quickly.
And I love the speed up of time because we know so much happens in that chair while you're waiting to get that pass or fail. So that's fantastic news.
Absolutely. It's all about patient safety. So the sooner our customers know that they need to remediate, the sooner they can actually take care of that. And also that way the practice doesn't lose production.
Yeah.
You don't want to have a chair down. There's a lot of money to be made every hour that chair and operatory is open. So we want our practices to be able to stay open.
So you discussed the safe water solution earlier, and there were 3 categories that were mentioned. Can you tell me a little bit about what's included in those 3 categories?
Absolutely. So the Sterisil Safe Water Solution is comprised of our testing solutions, which is Fast Check 15 and Sterisil R2A with Fast Read. We also, of course, have some other testing options. And then it's shock. We are the only end-to-end solution that has a shock solution as well. It's Citrasil with silver. And then we have a 365-day Sterisil straw, which is also a silver technology. So between our testing options, our shock solution, and our annual 365-day straw, we feel that we're providing our customer with an easy-to-use system of products that are designed to work well together with a protocol that's easy to follow.
That's fantastic. I thank you so much for being on today. I really appreciate it, Christina.
Thank you for having me.
And I want to thank all of you for either listening or watching this episode of the Dental Assistant Nation podcast in conjunction with drbycuspid.com. This is part of a 4-part series that we are working on with Sterisil, and we certainly send our appreciation to both Chandler Chatham as well as Christina Donahue for their expertise today. Until next time, it's Kevin Henry, host of the podcast and editor-in-chief for Dr. Bicuspid, signing off, and as always, wishing you nothing but success ahead.